Hi, my name is Jennifer Funke. This is the clinic I work in, and this is my video on lower extremity mobilizations. For demonstration purposes, my subject is a male. Our patient in reality is a female who has been hit by a car. She's 8 weeks out of her accident, not having a lot of pain because she's only taking NSAIDs occasionally, but has a lot of functional deficits. So we're going to use selected joint mobilizations to help her improve. I'm going to start my patient in prone so that I don't have to reposition them a lot during the treatment time. The first mobilization I'm going to do is a PA glide to the hip in order to increase hip extension. I'm going to bend the knee a little bit to put the hamstrings on slack, but not too much because I don't want to stretch the quads and the psoas as I'm doing it. I'm going to demonstrate a grade 3 PA hip mobilization. So we're going to go into the restriction and then large amplitude mobilizations. Also, while they're in prone, I'm going to do an anterior glide of the talus in order to increase ankle dorsiflexion. Ankle plantar flexion. I'm also going to do a grade 3 of this. So, for patient comfort, I'm going to put a little bit of a towel right there to lift it up. I'm going to grasp at the end of the ankle, and I'm going to put my other hand right here on the talus, and it's not a straight downward motion, it's kind of more of an angled. And a grade 3 would be into the restriction, large amplitude movements. Okay, then I'm going to have my patient move into side lying on the unaffected side. So on this side, my patient is side lying with a pillow under his leg for comfort. I'm going to be doing a medial glide of the calcaneus to help increase eversion. I'm going to go ahead and do a grade 4, grasp above the ankle, and hold on to the calcaneus with my left hand. So I'm far into the restrictions, small movements. And that is to help increase eversion. Patient is in supine. I'm going to do a transitional grade 3 and 4 hip distraction in order to help with the capsular tightness. You want their hamstrings on slack so that those don't fight against you. Grab as close to the hip joint as you can. And it's going to be at the point of restriction, and then use the body weight. Large amplitudes for 3, small for 4, and 3, and 4. Also in this, I can do some knee flexion mobilizations. I'm going to do grade 4. This is to help increase the knee flexion. We're going AP mobilization. So into the restriction, small amplitude movements. Okay, I've switched directions so that it's easier to view. Also with the knee, we're going to do medial patellar glides because she is having limited patellar movement. For demonstration purposes, I'm going to do grade 1, so it's just barely way before the restriction and barely moving. And then I'm also going to do some inferior patellar glides to help increase inferior glide. And this is going to be a grade 2, which is before the restriction and large amplitude movements. Okay, back to the hip. She is lacking in medial rotation. Normally I would do a grade 3 and 4 to help increase the motion at the joint. But again, for demonstration we'll do grades 1 and 2. So grade 2 would be a large amplitude, and grade 1 would be small, just barely into the movement. And back to grade 2. On an actual patient, this would be used more for pain modulation. Grade 1. And grade 2. Okay, and our patient is also lacking in hip abduction, so I'm going to do a lateral joint mob. Again, in an actual patient, I would be more aggressive, grades 3 and 4, to increase the motion. But for our patient, for demonstration, I'm going to go ahead and do a grade 1. So just barely. So I'm holding at the knee, but it's actually the hip motion. I'm also going to perform a posterior glide of the talus to help increase dorsiflexion. I'm going to hold my patient right like this, grasp right above the ankle joint, put my web space right here at the talocrural joint. And I'm going to do grade 2 mobilizations for this one, so large amplitude before the restriction. That's grade 2.